Respected chairpersons, dear audience, good morning. First of all, I would like to convey my sincere gratitude for this well-organized and thought-provoking conference organized by IPDI Foundation. I would like to welcome all of you to my presentation on 10 years cardiovascular disease risk among Bangladeshi population. We know that Bangladesh is committed to reduce premature deaths, which is like deaths between 30 to 69 years of age, by 30% by 2030. And we also know that non-communicable diseases cause 67% of all deaths in Bangladesh, and cardiovascular disease alone cause 1/3 of Bangladeshi population deaths. And we also know that cardiovascular disease is associated with multiple risk factors, but the current model of care doesn't account for synergistic relationship among these risk factors. If you take a look at the right side of this slide, you see that a person may have multiple risk factors at the same time, and current model of care doesn't account for those synergistic relationship. And also, current model of care do not identify individuals at high risk of at earliest stage, so that prevention or primary prevention of CVD can be ensured. And also, it may put people with low risk on lifelong and costly treatment. So that's why WHO recommended the use of 10-year CVD risk charts for the management of CVD risk factors and prevent fatal and non-fatal cardiovascular diseases. And there are two types of chart. One is laboratory-based that uses 6 risk factors: age, sex, tobacco smoking, blood pressure, total cholesterol, and diabetes. And non-laboratory-based chart uses 5 risk factors: age, sex, tobacco smoking, blood pressure, and body mass index. So this is a snapshot of like the risk charts, and and in 2018, the government of Bangladesh incorporated this approach in the national guideline. So in our study, we wanted to report the prevalence of 10-year CVD risk using this non-laboratory based chart among 40 to 74 years old population in Bangladesh, and this was a nationwide study. We obtained ethical approval from BRAC, James Buchanan School of Public Health Institutional Review Board, and CVD risk was calculated based on non-laboratory CVD risk chart recommended by WHO in 2019. So we recruited in this study, the analysis was done based on 781 participants, and among them 46% were female. The median age was 59 years. The range was, interquartile range was 48 to 65 years. And overall, the prevalence of very low, moderate, and high risk. Very low means like less than 5%, low means 5 to 10%. Moderate risk means 10 to 20, high 20 to 30%, and very high is more than or equal to 30% CVD risk. So that was 34% very low, and you see that like 25.9% had moderate risk, like more than 10% risk, 1.6% had like 20 to 30% risk. But this was different when we compared males and females. Males were at higher risk of cardiovascular diseases overall compared to females. But when people reach 70 to 74 years of age, you see that like almost all, all of them had like more than 10% CVD risk. And this is a busy slide, but you see here like, so male are at higher risk of cardiovascular diseases. When age increased, there is an increase in CVD risk, but there is no rural, urban, or between rural, non-slum, urban, or slum variation. The risk doesn't vary depending on education or even household wealth status, but currently married people are at lower risk, and there is no variation depending on religion as well. So, in summary, we can say that like 1 in 4 Bangladeshi adults had elevated CVD risk, like more than 10% of chance of having a myocardial infarction or stroke in the next 10 years. And we need clinical and behavioral management simultaneously, because and use of CVD risk chart can be helpful in this regard. And we recently conducted a proof of concept study whether this can be helpful, and we found that in the short run, CBD risk chart can help people to change their behavior, like quit smoking, improve diet, and also it can help people to adherence to medication. Also, like you see, like 80% of those people who are on medication could reduce, could have control on their blood pressure. So it is helpful. So in recommendation, we want to say that the government of Bangladesh should train primary healthcare workers on these CBD risk factors and for early diagnosis of people at high risk, and also this will prevent complications, harmonize and simplify management, avoid overtreatment, and also reduce catastrophic healthcare expenditure. So I'd like to thank you all, and also thank the funders and acknowledge the participants of this study and also others involved with this study. Thank you very much.